Hola, 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 buenas tardes. Hola, buenas tardes.
Welcome, everybody. Welcome to this very special session for United Cities and Local Governments within the framework of the High-Level Political Forum. This is a conversation between two movements, as I see it. The Universal Health Coverage 2030 movement and United Cities and Local Governments, the International Municipal Movement. I thought it was very important to promote this encounter between these important actors at a time of a global pandemic. So allow me to initiate this conversation between mayors and the activists, if I may call them that way, behind the Universal Healthcare 2030 movement, by giving the floor to Gisinyi Gitai. He's going to co-facilitate this session with me, and I am very, very pleased to have him with me. He's also the co-chair of Universal Healthcare 2030. So I would give you the floor, Gisinyi, for your introductory remarks.
Thank you very much, Lydia, my co-moderator, and I'm really
You need to speak closer to the mic.
Here, I hope that is clearer now. Thank you very much. I can have a very loud voice, so I shouldn't have a problem with being heard. I am glad to be invited here, and of course, this discussion is very timely between universal health coverage and, of course, the importance of local government, local governance to achieving the SDGs, and specifically SDG 3 for the people. I want to just make some very quick remarks that obviously, as we go through the political forum of 2020, it's a decade of action. I think that has been very clear. This is a decade of action. SDGs are global goals driven by local action, and health is not different. Local action is what we will drive the decade of action, even as we do our global advocacy and global peer accountability, which is being done sometimes through international reviews. So the local governments, as we are now partners, we even which is a multi-stakeholder partnership for universal coverage, which incorporates government, incorporate civil society, incorporate private sector, youth, and all other stakeholders in the achievement of UHC. We are really glad to see that we can have this partnership, which takes this particular SDGs all the way to local action. Health through
sorry, co-chair. We really have difficulties with your microphone.
You can hear me.
Now we hear you very well, but there are moments where we can't, and since we have interpretation, that is really an issue. So let us try. Is there something you are moving there? Because there is really a problem.
Get headphones. If you give me 2 seconds, then you need to have my hearing better. So, Amelia, would you mind? Let me get headphones.
Yes, that's okay. We will wait. Sorry, colleagues, but you know we have interpretation in English, Spanish, and French, and we need to be helpful with the interpreters. Otherwise, they will not be able to follow.
Is this any better?
This is wonderful. We can hear you now. Go ahead.
Thank you so much, and apologies for that problem. So I would have to repeat everything I said, but I have mentioned the importance of the global goals being driven by local action. I think this political forum is on the need for the decade of action, and that cannot happen unless there is local action, which is partnership with the local government, UCLG is really critical at this point. Remember also that health through universal coverage needs to be achieved on the foundation of primary healthcare. And primary healthcare is embedded on three legs. One is primary care, which is what we tend to think a lot about, but secondly is community empowerment and community participation, which cannot happen with the local governments. And thirdly is multi-stakeholder action, which again is so, cities and regions and local governments are so important in multi-stakeholder action. So this conversation that we are having now has also been informed by experiences on COVID now. That COVID has shown us that national policies that promote universal coverage, while focusing on access to quality and affordable services, have often neglected public health dimensions, where cities and local governments have a really critical part to play in public health dimensions. UHC, by definition, as we all know, we as a multi-stakeholder platform look at and work with many stakeholders to achieve, includes prevention, promotion, and emergency preparedness, all of which are common goals for health that actually not single individual can actually purchase these goods. So these are common goods for health that require public financing. Therefore, thinking of universal coverage as protecting everyone calls for us to have a renewed and urgent focus on public health actions as a first step. And therefore, governments are really, really critical partners in achieving that. This requires us to consider public resources not only centralized but also devolved public investment. And things like disease surveillance, laboratories, and diagnosis in support of public health activities, health information systems, and public trust in the health system, which we will be talking a little about later, which are likely not provided for by market and will not be provided for by market. So they require collective action by all of us. UHC has developed a paper which is on UHC and emergency, which is also endorsed by our political advisory group, which includes Maria, who I'm glad is here with us. And I think here is what I believe with. One, the new normal for UHC includes greater emphasis on common goods for health and public health action. Two, we must invest more, but most importantly, invest better for both health and economic reasons. We see that health is not just a consumptive good, it's actually a protector of economies. Three, we must save the movement so that opportunities for change that benefit both health, security, and UHC are now, and we must save that movement. And finally, the movements must get together for shared goals. And I think we cannot overemphasize the role of devolved systems in healthcare and the role of local governments and regional governments in delivering primary healthcare for their people towards universal health coverage. So I look forward to this conversation. I hand over to you, Emilia. I'll be coming back in the second part to have a conversation on resilience, equity, and trust. I look forward to the conversation and learning from all the regional government leaders and local government leaders who are with us here today. And back to you, Emilia.
Thank you very much, Co-Chair. There is a global commitment for global health, which wasn't there before, before the SDGs. And that is something that is important to realize. When the 193 member states of the United Nations agreed on the Sustainable Development Goals in 2015, they also set out a very ambitious agenda in relation to health, which wasn't there as a common agenda before. Well-being has not always been part and parcel of our development agenda, but now with the Sustainable Development Goals, we have these shared objectives, which is really important. So this is one important part of departure that has brought our organization, United Cities and Local Governments, with over 250,000 members around the world, to start this dialogue around healthcare, which was something that we were very interested in before. Is not because of the pandemic, but we have worked, for instance, very closely with UNAIDS, for instance, on making known how important it was to raise awareness among the population, etc. But this pandemic has allowed us to show how much of the service delivery we provide as a constituency is truly a backbone of the sanitary system. The sanitary system on its own does not have the tools to address health and well-being. And universal health coverage is very critical, but then we need to understand it as a whole of government and whole of society approach, a little bit like you were mentioning before, co-chair. So our constituency is very keen to make sure that the things that we are learning now in the midst of this global pandemic are things that we will continue to apply in the future, that will help us transform the way we were doing things. And I thought it was, as you said, I am part of the policy advisory group, political advisory group. I am very privileged to do that, but I thought we had to expand our message throughout the constituency of local and regional governments, because some of the experiences that we are having now show us that actually we will need to face in the future probably very fragile public service delivery ecosystems. And unless we recognize them as part and parcel of the sanitary message and of the healthcare system, we will actually be in trouble. And it's important to deliver this message in the context of the high-level political forum, because our constituency is actually responsible of around 65% of the targets of the SDGs. If we want to achieve the Sustainable Development Goals, then there is a lot of local action that we will need to do, and public service delivery is at the heart of that action. So that's the reasoning, colleagues, of this session, of this private session, the start of the dialogue, which we hope we will expand. It's a dialogue that we are having as well with the World Health Organization institutionally, that we are trying to formalize. But I think it's very important that we exchange notes, that we define priorities together about how to promote the notion that without universal healthcare, we are actually putting populations in jeopardy. And we will need to understand this beyond the context of the healthcare systems as we know them. So there is a part of rethinking those healthcare systems that is very important coming out of this pandemic. And hopefully that's what we're going to do today. With the two panels that we have. So I will go immediately to the first panel. And the first panel aims at exchanging ideas between UNHC 2030, so Universal Healthcare 2030 movement members, and the local action and the local experiences of elected officials. So let me start with that. The idea is to identify those things that we need to learn and maintain. Many of the temporary measures that we are taking will need to become permanent measures in the future. And I think this type of dialogue needs to help us prioritize. So the first question that we are going to address, and we will be strict with time, 3 minutes each, because we've got a lot of voices that we need to hear today, is what has been the main element in ensuring health services during the outbreak? Are there any challenges to keep health services in addition to COVID-19 testing treatments? And I am sure that the answers will differ from the local officials and the experts that are here with us today. But that's exactly what we want, is to learn from both constituencies. So allow me to start for that question with Ms. Patricia Montse. She is PSC Core Action Group, and PSC, I understand, is a private sector constituency action group, a founder and CEO of MexCare. So, Patricia, the floor is yours. 3 minutes.
Hi, everybody. Can you guys hear me very well? Because earlier it was a bit...
We hear you very well and we see you perfectly.
Top. So thanks for the invite, thanks for the introduction, and it was interesting to see that we call activists, while we are actually private sector, making sure that there is access to healthcare made available to everybody across the globe. Because the beauty of UHC, as you mentioned earlier, it's not just a movement, but it's actual things that needs to happen on the ground, both in the developed world, just as in the developing countries. So before I start, I want to share a statement with you that Dr. Tedros shared recently. He said, just as health is not the absence of disease, public health is not the absence of outbreaks. This is why we need universal health coverage. It is time to commit for health for all. And that commitment will happen at national level, but also at local and regional level. And that's why I was super excited to be part of this discussion, because what I strongly believe, together with my company, and I'm sure Gadi will talk about population health later, because AMREF is doing a lot of work from a resource point of view. My company kicks in more from a technology point of view. So what we've observed on the ground during the pandemic that has pushed a lot and made visible to everybody the need of having universal health coverage happening is the terminology smart cities. Couples of countries have it implemented, have started implementing, and some others aren't. The overall observation is that during the outbreak, countries with smart city started to implement, on the way of implementation or fully implemented, dealt with everything in a better way. And you know why? Because that one single element that you mentioned needed, the question was, what is the main element that we needed to ensure? We needed to remove fear. People wanted to be assured during the outbreak. So one of the things we've observed is that home has become a safe spot and a safe place for many. And what our local mayors and regional, driver of the city need to do, or of the country need to do, they needed to find a way to connect with the people at home. And there, technology played a critical role. We saw telemedicine kicking in across the globe, from the NHS, because I'm part of many of those groups. The NHS demand in telemedicine has completely raised because people were afraid to go to the hospital, whether it was COVID related or not, because many were afraid if they would go to the hospital, they might catch COVID during that period. So one of the things that we need to take away, and that's the angle I want to bring on the table, it's huge investment in technology, telemedicine, medical records, a strong connection to the patient-driven approach to healthcare, because that's one of the challenge we have with healthcare. So many actors needing to come in place, and that's one of the platforms we are creating now, because we'll need to talk together and bring all the know-how and the expertise and the processes and the system in order to make the ultimate patient and citizen of each of your local government cities getting that access to healthcare. And that's ultimately what UHC is all about. That will be it for me on my side. I'm sure we'll touch different topics, the population health topic, but ultimately I'm really open to answer any question related to technology and UHC later, because that's what my company does. And we've had quite some experience on that field.
Thank you very much. I think that nobody that's the role that technology is playing in making sure our society goes ahead. I mean, it just carries on in this time of pandemic. Thank you very much for bringing that perspective also in relation to health. Allow me now to go to Dr. Mohamed Boudra. He is the mayor of Al Hoceima in Morocco, and he's also the president of United Cities and Local Governments, and he's also a doctor by profession. So he's got this double view. There are, I have to say, there are many, many doctors in local politics. I have experience in my 20 years representing them. I don't know if it is a coincidence, but it's this urge to serve. President, the floor is yours for 3 minutes on this topic. Microphone, President.
Excusez-moi, merci Emilia. C'est vrai, cette double vision, ou cette double personnalité qu'on a en étant maire et médecin, s'est vue enfin unie lors de cette pandémie. Donc voilà, et c'était évident que le travail accompli par les professionnels de la santé était aussi garanti par les services publics des collectivités locales et régionales. On a travaillé ensemble, médecins, infirmiers et personnel de désinfection, de sensibilisation, d'organisation des commerces. On a travaillé ensemble, les uns avec les autres. Donc les messages des spécialistes de la santé, de l'OMS et de ceux qui représentent dans les territoires, ils ont été exécutés par surtout les collectivités locales et régionales. Et c'est la raison pour laquelle que moi, je pense qu'il est évident maintenant que pour réaliser la couverture sanitaire universelle, il faut toujours impliquer les collectivités locales et les régionales. Il faut qu'il y ait vraiment une compétence unifiée entre les deux secteurs importants de la fonction publique, c'est-à-dire les collectivités locales et régionales et les milieux de santé. Pendant toute la période de la pandémie, CGLU a encouragé ses membres à suivre de près les indications de la communauté scientifique et de coordonner, et de l'Organisation mondiale de la santé aussi, à garantir que les politiques locales viennent compléter ces lignes directrices. Grâce à l'échange d'expériences entre les villes et en encourageant les gouvernements locaux, régionaux et leurs associations à se concentrer sur les groupes les plus vulnérables, CGLU a joué aussi un rôle important pour mettre en évidence l'importance des services publics nécessaires pour soutenir les mesures sanitaires. Ces expériences ont mené à l'élaboration du décalogue pour l'ère post-Covid, un document important visant à garantir une transformation durable, soucieuse des sacrifices réalisés par nos communautés. Voilà le message que je voulais transmettre, Emilia, en moins de 3 minutes.
Oui, moins de 3 minutes, Président. Très bien fait. Beaucoup de choses à dire. Very, very relevant, this issue of linking the service provision around the healthcare. Well, housing, adequate housing has been very important. Providing quality food to the most vulnerable has been also identified as very critical, but also mobility, safe mobility has been extremely critical in this pandemic. So thank you very much. We will, I'm sure that other mayors will raise some of the issues that we have identified in the Decalogue, because health is not only physical, is also health from the soul, including culture as antidote for the effects of the pandemic. So let's hope that some of those things come up. Thank you very much, President. And I am going back to the co-facilitator and co-chair of the steering committee, to Githinji. How has your city or region addressed financial barriers for essential services during COVID-19 outbreak? Are there any challenges to remove user fees at the point of care. And boy, do we have experiences at local level about removing fees of public service. The floor is yours, Gitinji.
Thank you very much. I hope you can hear me this time. Is it better?
We are suffering, but you are worth listening attentively to. Go ahead.
Oh my God, I'm so sorry, but I hope you can hear me. I see Maria also shaking my head. I think the thing to say is that in Kenya specifically, where I live and where I am, we've had health as well as a default function to the local authorities, to what we call the county governments. So the county governments, which are 47 in a population of 47 million people, so now they can be taking care. Not good at all. Not good. The sound, I don't know.
Can we try to put up your camera to see whether it is eating up too much of the internet?
Can you close my camera and then here's the phone? Yes. So is it any better now?
A little bit.
A little bit. I'll also switch on my. I'll switch on my. I'll switch on my iPad and try there. I'm really sorry about it. I don't know why I'm having such challenges, but if you can hear me.
I think we prefer to have you with your camera back because now we cannot read your lips, so it's even more difficult. It's not working well. No. Let us.
Can you hear me?
Yes.
Fantastic. So let's do this now. I have got my iPad on and I hope you can hear me. So apologies, I've had to change, but good. So healthcare in Kenya is devolved as in many other countries. And what we have seen is sometime about 2 years ago, the government of Kenya did announce the need for universal health coverage, but it was announced within the framework of a devolved health system, devolved both in governance, devolved administratively, and devolved fiscally as well, which means that actually the regional governments, which each of them takes care of between 300 to about 2 million people, takes the responsibility of the entire primary healthcare, governance, administration, and finance, and also part of secondary healthcare, and the tertiary was left to the government. Now, what we've seen over time is even with the desire to achieve universal health coverage in Kenya, the political desire by the president, meaning we have very high level political will, it has been very difficult to actually achieve universal health coverage without the buy-in of regional and local governments, because they ideally are in charge of healthcare of the people every single day. Now, most of the programs you've had on UHC, two of them especially, free child health, vaccination, and everything else, and free maternal health, have had to get conditional transfer of grants to the regional government. Now, when COVID came, what we've seen is actually exposure of weaknesses within this system. Because of the absence of social protection, we've seen individuals who needed to be tested for COVID could not get tested because they couldn't afford and there's no social protection. We have seen that national government and regional governments, which needed to actually put people in isolation or quarantine because maybe you want to stop the spread or the transmission of the infection, were asking individuals to pay because there was no mechanism for financial protection for these services. And this resulted in threat of suicide, resulted in impoverishment of families, and therefore, and finally now, we have a situation where the national government has made a decision to devolve home isolation, to devolve isolation, so that now the county governments can take care of isolation, they can take care of people to be isolated at home, and also try to devolve testing and to devolve care of people. Now, one of the challenges we have is that many of the local governments do not have ICU facilities, do not have for oxygen, and there is no option to transfer patients because even the urban center, the capital center, has a shortage of these services. So what this is bringing to the fore is the importance of kind of devolving, fiscal devolvement as well. and ensuring that enough money for healthcare, which is publicly provided, is devolved to the regional governments, is they are given the power with the money as well to provide healthcare to the people. And the importance of bringing in universal health coverage, because out-of-pocket payments or fee-for-service is still a big challenge across all the cities in Kenya and obviously around the region as well. So I would like to leave it there. I know I'll be coming back, but this is the challenges we are having and the importance of fiscal development, adequate fiscal development to the regional governments which are in charge of health provision. Back to you, Emilia, and thank you for the chance.
Thank you very much, and we could hear you loud and clear, and you cannot imagine how happy we are. We could be spending the whole session talking about devolution. You have found the right group here to talk about that, and I am sure that the mayor of Ramallah, Musa Hadid, is going to talk to that as well, to that type of challenges. It's about having the competencies and also the resources, but it's the competencies also beyond the healthcare system as well, I think. Mayor Musa, the floor is yours, 3 minutes.
Thank you, Emilia. Good morning and good afternoon to everyone who's joining us for this session. You know, Ramallah, as all cities across the globe, is on the front line to respond to the COVID-19 pandemic and to the consequential threats and crises. The COVID crisis is no less threatening than the political hazard imposed by the occupation. Sorry, I have to tackle this today also. Whilst Palestinian municipalities and the world are facing the immense impact of the pandemic, Palestine is threatened by the Israeli annexation plan of the West Bank, a plan that aims for the illegal annexation of what is called C zones, thus jeopardizing the livelihood of almost 60% of the occupied Palestinian territory and its citizens. In fact, this annexation plan is imposing a dreadful financial and health crisis on our country. This plan has brought financial sanctions, cut off foreign aid, and restrained the tax clearance revenues. Just recently, my dear colleagues, the Israeli government has restrained the COVID-19 medical supplies to the West Bank, meaning that for almost 4 million Palestinians will lack testing for COVID-19 and will lack access to sufficient health support. Given the background of health and political crisis, studies from the Palestinian Central Bureau of Statistics estimates a 14% contraction in GDP, thus puts additional efforts on local governments in the recovery from the pandemic and places citizens to unfulfilling their obligations due to pandemic outbreaks and its implications. Our municipality had cut down its annual budget by almost 50%, allocating residuals on critical and supportive services. The COVID-19 has brought further new responsibilities to local authorities, of course, as the financial constraints are compiling, the city demands are as well. When cities entered a lockdown, the local authorities not only provided the critical services, we became the first line responders to citizens' social needs, and within the minimal resources, we organized cultural and social activities while assuring that city neighborhoods are disinfected and safe for all citizens. A projection of the World Bank also states that the global remittances will decline by 20%. This should urge us to collaboratively dig out from the economic fallout and to be hand in hand, of course, keeping social distancing, in suppressing the health fallout of the pandemic from the 21st century challenges. Local governments and all stakeholders should have the willingness to think out the new normal, define the challenges, and match needs with the resources. This collaboration can conclude in a scheme that could support cities, digital infrastructure, and emerging new solutions that adapt to the new normal, to create new jobs, of course, and that fill the economic and health gap due to the drop in wages and employment and abrupt challenges on our health system.
You need to wrap up, Mayor.
Yeah, finally, I call on you, dear partners, to join us in raising our voice toward against this flagrant violation of law and values in defense of the Palestinian people's right. Thank you, and back to you, Emilia. Thank you very much.
Thank you, Mayor. You have raised very important issues in relation to the difficulty to continue financing public service provision. It is something that we are seeing also across the world, not only in the challenging situation of Ramallah and Palestine, but across the world, public service provision has stopped receiving income. You know, public transport systems have been riding for free. There have been many more meals that have been provided by municipalities. And I think that will need to be part of the conversation when we talk about the achievement of the Sustainable Development Goals, and also maintaining or reinforcing the healthcare systems. So thank you very much for those inputs, Mayor. I'm going now to the last part of this panel, and we are going to be asking the next panelist about how populations have been reacting to the lockdown. It hasn't been easy everywhere. Have they accepted the physical distancing measures, for instance? And to which extent have we had to involve communities to actually ensure that those decisions were owned by all and respected by all? So I am delighted to give the floor to Mrs. Smitha Sadasivan, CSMEM Advisor Group member. You might want to explain what that is, sorry for my ignorance. A member of the Working Committee on Multiple Sclerosis Society of India, Chennai. The floor is yours for 3 minutes.
Thank you very much. So from my experience as a person with disability and working with persons with disabilities in India, living in Chennai, one of the hotspots for COVID-19 in our country. So COVID-19 lockdown have had a drastic negative effect among vulnerable populations. Physical distancing has been an issue for people with disabilities who take support from others for personal care, and moreover, caregivers found it difficult to travel to attend to people with disabilities. And we didn't have anyone to attend to our personal needs when our family members, who are our primary caregivers, got quarantined in COVID. And many died due to delay in treatment, lack of food, homelessness, lack of medicine, etc. You know, families inclusive of persons with disabilities consumed poison and killed themselves due to lack of livelihood and support. And many family members killed their family members with disabilities because they started behaving violently due to lack of medication for psychosocial disabilities. And so all such instances happened. Yes, in our state, community representatives were involved to some extent by the states, and you know, the civil societies are basically serving as a bridge between government and people, and reach to the most vulnerable people where government can't also reach. And we helped the government to set up toll-free helplines and telemedicine services and other support systems. And despite that, though the government did announce assistance in cash and kind, but the information did not reach everywhere, and other challenges where implementation was also ineffective and didn't reach all vulnerable people. And services were inadequate and did not address the specific needs of vulnerable groups. Therefore, the focus should be health should be acknowledged as a political priority, increase public health financing and financial protection immediately, and community support structures should be enhanced with specific focal points in all the government and community infrastructure with appropriate data on specific requirements of vulnerable people in the community so that it can be addressed then and there to ensure that no one is left behind as provided by the CSCM COVID-19 calls for action. And I would like to end by quoting CSCM COVID-19 calls to action. Cost of inaction is significantly higher than the cost of investing in health even during recession. Thank you very much.
Thank you very much for bringing this important topic. I mean, it is true that we often say that our cities are not made for the most vulnerable. And this is a truth that we need to accept if we want to change it. And we are failing indeed to ensure that that people with disabilities are included sufficiently. And what this pandemic has done is to make that even more clear. Now, the response to that is of course challenging for any sphere of government. But what we would hope is that we can make sure that some of the temporary measures that we have undertaken, as we were saying at the beginning, become permanent, and the dialogue with the groups represented, those vulnerable groups are very involved in finding the solution. So thank you very much for this. However, I think that the issue of citizens not acknowledging the lockdown or not wanting to follow the lockdown is even bigger in groups where they are very dependent on economic activity day to day. And I think in India you have also experienced that. So let us go to Afghanistan now and invite Ms. Khadija Ahmadi, the mayor of Nili, to see how she has experienced this. Are you ready, Mayor? Mayor Khadija?
Can you hear me?
Very well, loud and clear. Okay. Go ahead,
okay.
3 minutes.
Okay. Hello, good afternoon, everybody. In Afghanistan, we are a long way from having universal health care system. Coronavirus is the latest threat of many to Afghanistan and is strengthening our weak healthcare system to us. Officially, Afghanistan means over 1/3 and almost one of the people who have been tested are testing positive. We know that the real number of cases is much higher. Local mayors and city are on the front line. In my city, Nili, we are one of the first city to experience the outbreak. Other side, about 10,000 people per month return from Pakistan and Iran to the city, and also IDP and refugee or other guys to be add more challenges for us. But once the outbreak started, the national government introduced lockdowns, but it was the mayors who were responsible to implement this action and meet the needs of residents. The lockdowns caused great economic impact for Afghan people because most people are daily wage earners and people suddenly had no livelihood opportunity. For example, the municipality lost a lot of revenue during lockdowns in Nili. But in response to this question, I want to provide a fourth area where I think our health system need to be transformed in the coming years. First, we need to be strengthening local health care and ensure it's distributed across the country across the country. In Afghanistan, we had only 3 clinics for COVID-19 testing and treatment in Kabul, Mazar, and Jalalabad is the mega city. It's far from the Nili and a small city in Afghanistan. People had to wait weeks for their test result and had no access to other medical supplements. And so healthcare system need to be better distributed to sub-national level to ensure people have access. The second, we need to address issues and challenges for women, especially women in Afghanistan do not have the same mobility as men, and widow female-headed households are particularly vulnerable to shocks. So we need to improve not just their access to healthcare, but economic support for women. For women and other vulnerable groups like IDP, returnee, and other guys. Third one is we need to look at universal healthcare from the global perspective. The coronavirus pandemic highlights how interconnected the world is, and that we must improve healthcare system globally until whole countries are better prepared for pandemics. The trick will be there for all countries. But let me back to the main point. There is the close relationship between health and security. Unfortunately, the lack of the security in Afghanistan, especially in my city, we cannot offer, and healthcare service to the border of the city is controlled by Taliban. But I think it's the first step for us to be building the peace and security and work more on the healthcare system. But the third one is, the last one is to be, I hope the last one is to be more contribution of the national level to the local level. But I always to blame other, especially the national level, just to be a policymaker. But this period show us the local government is the front line of the implemented some in the crisis time. But I expected to national level more give authority, more give the budget to local level for this crisis, for this time. But I want to end by offering my condolences to this country and fellow panelists who have been impacted by the COVID-19 disease. Thank you so much. Thank you for this opportunity.
Thank you very much, Mayor. I know that you have had to make big efforts to be able to join us in this Zoom platform, and we are delighted that you have been able to provide your inputs as well. As we can see, it is very difficult for local and regional governments to look at these issues from a sectoral perspective. It's all very interconnected. The context weighs heavily on the type of decisions that we need to undertake. So let us now go to the second panel, and let us hope that we still have some room also for additional inputs. But I will go to you, Githinji. The best of luck, I would say, with your panel. Thank you very much.
Thank you very much, Amelia, and thank you, and best of luck with my sound as well, I would say, which is probably now behaving much better. This session, this second panel, we have a few minutes for it. We'll be looking at how to build back better, or how to bounce forward. What is it we can learn from the COVID situation? How can we make ourselves better prepared for emergencies in future? And how do we make this inclusive, build consensus, and also unite behind shared goals? I am really excited that we are having this conversation because I'm a great believer in devolved power to the people. I am a great believer in devolved governance, where people actually make choices for their own lives. And the conversation we are having here is exactly about that. It's about how do we make sure that, the power to be healthy and the need and the right to be healthy is participatory with your government, with planning together, budgeting, responsiveness. And we know that turning national governments to respond to community needs is a really difficult issue. But when you have regional governments and local authorities, they are more responsive to the needs of the people at the center. So how do we, with this concept of devolved agency, how do we then look at building back, learning our lessons and moving forward? In this session, we have very good contributors. I would like to obviously recognize some of the people who are sitting on the UHC Movement Political Advisory Panel. We have Dr. Biteni Spovilas, who will be speaking to us shortly. Of course, we have Maria Espinosa, who is the president of the 73rd session of the UN General Assembly, and was actually a key driver in the UHC high-level political declaration, which we are holding commitments to. There are three things we are going to address in this session. One is building resilience into the health systems. Building resilience. I can imagine the conversation between a Minister of Health and a Minister of Finance saying, please, let's build for the next pandemic. And the Minister of Finance saying, what if we build and that pandemic doesn't come? And the Minister of Health saying, what if we don't build and it comes? And this is what we are having now with COVID. We didn't build, now it's here with us. So the first question we are going to ask is, how do we build resilience into the health system, both physically and financially? And I would like to ask Midori Habich, who is actually an economist and a former Minister of Health in Peru, who's worked with us at the UHC 2030 movement a lot to build strong health systems, to comment on this issue. How do you think our health systems need to be transformed to ensure they are resilient, both physically and financially? Over to you. Your mic is muted.
Thank you so much.
Thank you.
Thank you. Thank you so much for the invitation. Greetings from Lima. And I would like to start by acknowledging governments at all the different levels, health workers and communities around the world that are struggling and working so hard in these times. So acknowledging them is putting them at the center of the discussion. And I think that building on what the UHC movement has been voicing very strongly over the past months, I think that we should draw attention to some key balances to keep in mind when we think about the health systems going forward. The first one, I think, and has been mentioned, is how to keep the balance of continuity of care. We have seen that, and that continuity of care means thinking about public health functions and interventions on one side, through community care up to the highly specialized care of the health systems. And what we have seen in many cases is a very tunnel vision on hospital beds and intensive care units. And we have seen this around the world, and we have forgotten a little bit about the continuity of care. And maybe for good reasons, because that's where the health system problems appear more clearly, but not necessarily where they are originated. And they are originated because we have not built into our systems good public health functions and integrated the community into the response. So this tunnel vision has overshadowed these issues that we are discussing today. And I would like to draw on our first speaker, who was talking about technology. Technology like telemedicine and others that are bringing together or more closely to home some of the messages and even the care that is needed. And so this is the upside, maybe, of this terrible situation around the world, the possibility and the potential of new technology and innovation. In the second term, I would say balancing, again, the COVID response with the provision of other health services. In many cases, we have seen other essential health services shut down even to focus exclusively on COVID. And this is bringing very serious consequences now and in the near future. So we need to keep a balance. We know that this is a hard thing to do, but we need to keep the balance between the COVID response and other essential health services now and in the future. If future pandemics appear, hopefully not, we need to be mindful that we can't just shut down everything else and just focus on the pandemic or the epidemic. Thirdly, avoid this vertical short-term response. Again, for good reasons, we are sort of locked in to discussion of very short-term interventions and policies, sometimes with a very vertical approach. And I think we need to look and take advantage of this crisis to think about articulation of different levels of government. In countries where there's a high level of fragmentation in the system, this is the moment in which we can come together and think of diminishing the effects of this fragmentation. There is political will, and I think it's a good opportunity to put these sort of medium to long-term considerations in the short term now, to think about these drawbacks of our systems now instead of just focusing on very short-term issues. Finally, I think that we do need to rethink the way in which we have conceptualized our health systems in general in two fundamental ways. One, incorporating with much more explicitly the public health functions into our understanding of a health system. We do, and we have in the past considered in our building blocks and in our analysis of the health system, there was this other thing about public health, but we did not incorporate it fully into our understanding, our analysis. And the second thing, of course, putting the community actors and actions in the center of an analysis of the health system. And we need to go back to the drawing board for that. Thank you so much.
Thank you very much, Midori, for reminding us, most importantly, that actually the health system that is needed by pandemics is the same one that we need for UHC. That's actually the same health system that is equitable, it is strong, and is resilient. It is one health system that then gives us a good foundation for both. And reminding us that the responses to COVID-19 must not be separate from our commitments for building a universal health coverage system. And also reflecting on the area of technology and innovation, the role of governing health futures, and looking at ending verticalization. And COVID must not be another vertical program. It needs to be embedded in an overall response. So thank you very much, Midori, for that. I would like to come to ask Jean-Pierre Mbasi. Jean-Pierre is the Secretary General of UCLG Africa, of course, a well-known, urban governance expert, and has been at UCLG for quite a long time. So, Jean-Pierre, could you talk about this issue of resilience and what do you see as the role of local governments and local authorities in building this resilience for the health system of the future?
I really appreciated what Madame Midori de Habish just said. It is very enlightening on the way we have to rethink the whole system of access to universal health care. What we saw in this pandemic is that, first of all, it doesn't have any respect for government and nor for national boundaries. So it shows that we need to work as human beings all together to come out of it. It has also proved that this is an ecosystem disease. And this ecosystem disease stems from the breach of equilibrium between human beings and the other living beings that we share the planet with. be it fauna, flora, and so on. What this disease has demonstrated is the over-attention we have put on curative medicine compared to preventive and environmental health. And this negligence is totally contrary to what science evidence has shown, that over 60% of the diseases are linked to lack of adequate drainage system, poor clean water and sanitation services, poor waste management services, air pollution in-house, at the workplace and in public space, poor management of mobility and transport system, lack of sufficient and adequate food, stress stemming from lengthy time spent in commuting from home to work, to school, to other public facilities. All this has to do with the competencies of local governments. So if we want to address the post-COVID, let's put the communities and the local people at the center of the health system, and let's empower them to take up these challenges. And then we will have to have less people that are ill. We will have to have less stress in hospital, and we'll have to get people taking care of themselves. It is demonstrated, but I don't know if this is totally true, but that when we eat better and so on, we are less ill, and the healthcare system is less solicited. So this is where we have to work with the communities. And for example, in the case of Africa, the lockdown was not followed because people had to fetch for food and to feed their families. But thank God, young people are prevalent in Africa. So we were hit by the disease, but not at to the extent that it killed so many people. The disease has killed in Africa close to 2,500 people or 3,000 people compared to one day in the US. So it is important to understand that we need to shift to more preventive in environmental health to be able to address the coming pandemics. Thank you.
Thank you. Thank you very much. Thank you very much, Jean-Pierre, and for those remarks. And again, we will, you remind us here that actually the Minister of Local Government is actually the best Minister of Health. Over 60% of health issues are related actually outside the budget of the health sector. And this is something we've known, that's why primary healthcare has a strong arm of community and multi-stakeholder. Move to, and I'm aware that I've been requested, Maria will need to leave early. So if you allow us, you'll go to this and then I'll request you to speak before Joy for Murphy. If Joy allows, I know Joy is very kind, so she'll allow you to speak before her, Maria. But I would like to go to the next question on the issue of equity. What changes do we need to do so that at all levels we have access to healthcare to all populations, including those that are currently left behind? You know, especially, you know, we know women and children, women and girls left behind. We know populations on the move, vulnerable populations, poor communities. So what do we need to do to ensure there is equity in this building back better? So I would like to ask Dr. Vitenis Povilas, who is a member of the UAT Movement Political Advisory Panel. Over to you, Dr. Vitenis. I hope I got your name right. Your chance. Hello, we can't hear you. Dr. Vitenis.
Yes, do you hear me?
Yes, your mic was muted. Now we can hear you now.
Okay.
Welcome.
Hello. hello once again. Thank you very much indeed. Very, really, very powerful panel, a lot of speakers. I am very happy to listen to you. And first of all, you know, we just celebrating Bastille Day. It's very important because it opens doors to the declaration of the right of man and of the citizens. And it's about human rights, and health is a human right itself. And you know, now what we are doing, we're defending such fundamental human rights. Now look, may I quote Dr. Tedros on Monday. He sent very clear message to all of us. Let's quote, "Let me be blunt, too many countries are headed in the wrong direction. The virus remains public enemy number one. If basics are not followed, the pandemic is going to get worse and worse and worse." It's for all of us, this message around the globe, for all cities, for all local governments, for regional governments and national government. Please listen. Such very, very important, you know, sentence from Dr. Tedros. And we know very well, we have 4 scenarios in our hands, which were elaborated by WHO. 0 cases scenario, sporadic cases, cluster of cases, and community spread cases scenario. And all those scenarios must be on our tables today, now, you know, doing concretely our actions on the ground. Because we need to have in our hands what? We need to have in our hands measures, resources, and of course, all instruments and capacities. And of course, the people should be on our health. You know, now it's a very big question. Who must lead in the world today? Of course, WHO, no doubt. WHO is a leader, you know, not some politicians who base their actions on their beliefs. Sorry, we need to base our actions on science only. And science must be now the guiding tool in all our achievements. And what change needs to be taken at all governments level? Of course, more emphasis on preparedness to be done today, according to the guidelines developed by the WHO at national, municipal, and local level, to assure equal access according to needs in the period of crisis. Will in advance prepared algorithms are needed. Well in advance harmonized actions globally, regionally, and locally are needed. Now we can repeat once again, we know very well need much more cooperation, collaboration around the globe at all levels, but nobody likes to be coordinated. That is a question. Please look at global level. We need to have global governance, of course, no doubt. But can you see different voices in different countries? It is very dangerous. And we need to send messages. Coordination, cooperation, and steadfast solidarity is needed. Now, it is a number one message is, of course, we need to have better health education of population and politicians. And of course, all vulnerable groups should be at the center. And you know, more investment into critical reserves of supplies, healthcare institutions, proper organized healthcare workforce, emphasis on cutting health infrastructure that recently prevailed has to be questioned. Now it is absolutely clear, investment, and once again, and investment at the local level, because local level is a place where we can solve concrete problems in concrete continent, in concrete region. The European Union response, in response to COVID-19 increased its public health budget 20 times. But what about Americas? What about Asia? What about world financial institutions? Now we will call that we need to have investments, proper investments in our hands. Of course, let me conclude that we know very well what should be taken. New normal, as new economic model, it should be taken, no doubt. We need to pass message to all people that physical distance, wearing mask, washing hands, and of course limits of big gatherings should be on the place. Doesn't matter. 0 case, sporadic cases or clusters of cases. It's ground. Of course, improve monitoring, data, and information sharing now, identify, mitigate, and manage risks, especially keeping eyes on vulnerables, and promote, prevent emergencies to support development of tools necessary during outbreaks, and keep on the center social determinations, because we know very well who suffers much more today. Those who are much more vulnerable. Doesn't matter in Afghanistan, in Kenya, in Uganda, or in Lithuania. The same situation. We need to pass a message very clear that today we need to have commitments to sign global agreement about new models, about new economic models, about possibilities to guarantee continuity of our services, and of course investment locally is must be slogan. Thank you.
Thank you. Thank you. Thank you very much, Dr. Vytenis. And I think you made really critical point. I would just like to pick one, that the pandemic has hit the most vulnerable most. And this is really something we must always remember, that social protection, which includes UHC and health, is core to the response, the pandemic response, not only for COVID itself, but also for the effects beyond this. I would like to ask Mr. Carlos Martinez, who is the mayor of Soria in Spain, and also a UCLG envoy for the urban agenda, to comment on this issue of protecting the most left behind, to protecting equity, to make sure that all the people that we have are actually protected, and especially those left behind first. Over to you, Carlos, for your 3 minutes, and please keep it to 3 minutes. Thank you.
Muy buenos días y muchísimas gracias. Espero que se oiga perfectamente. Voy a trasladar algunas reflexiones acerca de la pregunta que se me hace. Como premisa, ¿no? Yo creo que si alguien ha estado a la altura en esta pandemia ha sido la propia ciudadanía, cuya respuesta ha sido absolutamente ejemplar en todos y cada uno de los países ante las medidas de distanciamiento social y de cambio en la vida ordinaria que se le ha puesto encima de la mesa. Lo decía mi anterior interviniente, estamos ante un problema global y necesitamos una respuesta global que no se ha dado lamentablemente por el acoso y derribo que existe desde distintos estamentos, distintas administraciones precisamente al sistema multilateral. Hoy debemos alzar la voz más fuerte que nunca para defender el papel de la Organización Mundial de la Salud. El COVID afecta a todos por igual, el COVID afecta a todas las personas y a todos los países, pero no afecta a todos por igual. Se ha evidenciado en esta pandemia la desigualdad entre los distintos sistemas sanitarios. Por tanto, se ha agudizado, se ha puesto encima de la mesa la necesidad de más inversión en todos los sistemas sanitarios, en 3 aspectos: en prevención, epidemiología, en asistencia primaria / local y en asistencia hospitalaria. En segundo lugar, solo un sistema sanitario público bien planificado, dotado de materiales técnicos, de materiales humanos y de material sanitario, es capaz de garantizar la cobertura en igualdad de condiciones a todas las personas y en todos los territorios. Y de ahí se deriva la absoluta necesidad de entender la salud, asistencia sanitaria como un derecho y garantizarla desde el punto de vista de la sanidad pública y universal. La sanidad pública no debe contemplarse única y exclusivamente desde el punto de vista de la atención sanitaria. Hoy es más necesario que nunca integrar la salud en todas las políticas y en todos los servicios públicos, en todos los niveles de las administraciones, especialmente en el nivel local, dentro de lo que nos refleja ya la Agenda 2030, dentro del marco del Objetivo de Desarrollo Sostenible número 11 y el Objetivo de Desarrollo Sostenible número 16, es decir, dentro de la nueva agenda urbana y su gobernanza. La nueva agenda urbana como solución ha de entenderse como la herramienta global con la que aplicar la acción política para el cumplimiento de la Agenda 2030 en los espacios compartidos de convivencia que son las pequeñas, medianas y grandes ciudades, que deberemos abordar diferentes agendas urbanas desde la perspectiva de la salud, ODS 3, desde la perspectiva de la educación, 4, de la igualdad de género, 5, o la lucha contra el cambio climático. Deberemos abordar agendas urbanas mediante la planificación urbana y una ordenación del territorio sostenible e inclusiva, que sea capaz de garantizar la conectividad, la vivienda, la accesibilidad, la movilidad, el transporte público, los espacios públicos y la conservación de nuestro patrimonio natural e histórico, que dé cobertura al abastecimiento y depuración de nuestras aguas, al aire limpio, al acceso a la cultura y al deporte. En definitiva, una nueva agenda urbana que tenga un enfoque integral y transversalmente desde la perspectiva de la salud, por lo que será imprescindible alianzas y diálogo con todos los niveles de la administración en una renovación real. Yo diría hoy, el día de toma de la pastilla, como se ha dicho, de la pastilla, de una revolución del sistema multilateral en el que la ciudadanía y la propia OMS, los gobiernos locales y el resto de las administraciones asumamos el ODS 16 y la horizontalidad con los principios de gobierno abierto como la clave de todo este proceso descentralizador. Finalizo con dos argumentos más para la búsqueda de ese consenso con todas las administraciones y en todos los países. Dos argumentos que son capaces de convencer al pensamiento más ultraliberal, que es el término de la seguridad. No hay mayor inversión para proteger el derecho a la vida que la inversión en la salud pública y universal. Y el argumento de la economía. La única forma de garantizar la salud de la economía es garantizar la salud de la ciudadanía. La mejor y única manera en una economía globalizada de garantizar la estabilidad y el desarrollo social y económico es garantizar la asistencia sanitaria de una forma pública y de una forma universal. Ese es el reto que tenemos por delante y ese es lo que tenemos que intentar trabajar entre todos. Muchas gracias.
Thank you. Fantastic. I think, very clear message here. Health and economies are intertwined, and for you to protect economies, you must protect health. So thank you very much for that. And I know we are running short of time, but I would like to now tackle the question of trust. We have two key attributes. One, governments are trusted enough by their population, so their strategies are supported. And secondly, managing across multiple stakeholders and organizational boundaries with clear accountability is necessary. Now, I want to invite, I want to request Joy to allow me to call Maria to comment on this question. And Joy, when I come back to you, you just launched the IAP accountability report. How does that reflect in this context? But I would like now to invite, Madam Maria Espinosa, UHC Movement Political Advisory Panel, but also president of the 73rd session of the UN General Assembly, and who was involved in the high-level declaration firsthand. She drove that, she was chairing that, she was the president of that. Maria, how would you comment on the issue of trust, building trust in communities, both nationally and regionally? Over to you, Maria.
Well, thank you very, very much, Chair, and thank you, Emilia, for this incredible gathering. I think this connection of scales is what we need precisely. Let me share just a few numbers. From time to time, it's good to just drop some numbers so we remind ourselves what we are facing. And we have to remember that half of the world's population lacks access to essential health services, 50%, and that health expenses drive almost 100 million people into poverty each year. So, and we have to remember that we do have a framework, an umbrella, and that was adopted last September, as was mentioned by our chair. We have the most ambitious and comprehensive political declaration on universal health coverage, and we have to comply with our commitments. So, and the declaration recognizes universal health coverage as fundamental for achieving Agenda 2030. And it reaffirms health and well-being as central to eradicate poverty, to build gender equality, women's empowerment, promote inclusive societies. And unfortunately, COVID is making a bad situation even worse because of the numbers I share with you. Just a few more numbers here, but I think they're worthwhile. Mother newborns, young children, and adolescents are losing 20% of their vital access to health and social services. So disruptions on health systems and food insecurity could increase maternal mortality rate into more than 38.6% per month, and an additional 1.5 million child deaths in the next 6 months. So the situation is really not encouraging, talking about trust, and is in the midst of these devastating effects of a pandemic that we're gathering today to assess implementations, to explore opportunities to share our firsthand experiences, that we have heard from mayors in such a clear and bold way. So how to cope with the pandemic from the lens of local governments, but how to boost trust in the decision makers, the leaders. And the number one idea is that we need inclusive and participatory policy and decision making for health strategies and actions. And these are not only words, but evidence. I have been reading assessments on COVID responses, all show that civil society, women, and other vulnerable groups, such as indigenous peoples, persons with disabilities, have not been included in decision-making regarding the pandemic. So recent analysis confirmed this deficit at the national, but also at the international level. A multi-stakeholder approach is certainly needed to ensure effective action and effective delivery on universal health coverage, but also on COVID-19 responses. So I think that COVID has taught us that how important it is that of building trust through participatory and accountability processes. For example, we all know, now we repeat that number, women make up for the majority of the health workforce, but continue to be excluded from high-level decision-making structures. And this is critical. And of course, I know policy responses to COVID are not easy. Political leaders at the national, but also at the local level, are confronted with very hard choices, navigating between controlling the outbreak while protecting other essential health services and restoring the economy and everything at the same time. So we understand the difficulties. And I would like to perhaps conclude by saying I lost my notes because of the, sorry about that. Sorry about that. I wanted just to conclude, if I may. I lost, sorry, Chair, but I lost my notes that they were in front of me, and I need to spend some seconds to make sure that that I have my notes in front of me. So sorry about that. And basically, just a call to say that we have to look forward to 3 deliverables from UHC 2030 in the coming months. The number one, a handbook on social participation for UHC that has been prepared by WHO and UHC 2030. It will be released this fall. It basically provides some guidance on how to go about a whole of society approach as the only way. You know, both participatory and accountability mechanisms should be institutionalized as recommended by the recent independent accountability panel report that we're going to hear about later. I think that precisely to respond to the recommendations of the report by Universal Health Coverage Day, which is the 12th of December this year, UHC 2030 will present its report on the state of UHC commitments. And the third deliverable to look forward is that we launched yesterday a survey to hear people's voices on the ground about UHC commitments in action. So I invite you to participate, to engage, to be part of the UHC movement. I think that social agency is critical, not only for accountability purposes, but also for more effective solutions. And if I still have 2 seconds, Chair, I would like to say what I have heard today. It was so rich, but perhaps 3 quick takeaways. We need to connect the scales, to connect the local with the regional and the global. Each scale has a distinct role to play in guaranteeing universal health coverage. And multilateralism today, as the mayor of Soria was saying, requires the voices of local leaders. Governors, mayors, communal leaders are key actors of global governance arrangements, as well as response and recovery plans for COVID. True decentralization is more needed than ever, but decentralization with power and with resources. And I am a strong believer that decentralization has also to come to the UN. the voices of local governments in global governance arrangement are critical. And the convergence of times, short-termism, we need to fight short-termism and think about future generations and not the future elections. I think
Thank you very much.
So thank you, Mr. Chair, and I would like to close with that.
Thank you very much, Maria. Thank you very much, and we'll take you up on that to assist us to make sure these voices are the UN in this decision making. And I would now like to go straight to Ms. Joy Fumafi, who is the co-chair of the UN Secretary General's Woman Every Child. You released your IAP accountability report yesterday, calling on all of us to make progress, justify, account. Please, over to you, Joy, on this issue of trust. I think you have exactly 2.5 minutes because most of your time has been taken by many of us, but I hope you can afford your 3 minutes. Over to you, Joy.
Thank you so much. A pleasure to be here. We believe that the duty of trust is central to good governance. And we have focused in our recommendations on 3 primary areas of accountability, which are central to this duty. Once a government or a partner has made a clear commitment, they have a responsibility to act and fulfill that obligation. We believe that governments should ensure death is registered. This their relations, the budgeting, the policy, making the programs, and target and reach all citizens to address the causes of mortality. The second recommendation we've made is that all actions must be fulfilled on the basis of science and evidence on human rights and the rule of law. At the same time, there must be continuous progress through the process of progressive realization. It is not enough to do no harm. Yes, we appreciate that Rome was not built in a day, but a whole of government and whole of community approach is absolutely critical so that all policies, programs, services must contribute towards the realization of these goals that we have committed ourselves to, that have been agreed with the people and promised to the people. We envision institutionalization of accountability that established a formal relationship between monitoring with a complete, effective quality data surveillance system, linking that to the reviewing process and remedying non-performance, taking action to deliver. But most importantly, this accountability mechanism, this fully democratized. And this full democratization should be demonstrated in a universal health coverage primary healthcare model where the voices of people who are key to every element and of the whole governance system and communities, whether they be women, adolescents, people with disabilities, minorities, indigenous groups, all ethnic groups, different races, the poor, mobile population, the refugees, where all these voices are heard and are essential to every single element, and their needs and demands are acted upon. What we are saying is that the SDGs and universal health coverage are a promise by all of the world's people, to all of the world's people. And the governance mechanism structures, those who have a responsibility, have a duty of trust and care and are accountable for delivery to every citizen of this planet of the quality healthcare and wealth that has been promised. We also believe that the COVID-19 pandemic, as people have been saying now, does not leave the governments and the partners' responsibility, but rather it. Thank you so much.
Thank you very much, Joy. I know we are running out of time, so I'll just make one closing remark. That the challenge towards UHC 2030 and also our partner here, United States and local government, is to institutionalize participation and create the enabling environment for that institutionalization. That's my closing remark. I must thank all of you as I now hand over to Emilia to make her closing remarks. Thank you very much, and back to you, Emilia. Thank you.
Thank you very much. I know that Carola Gunnarsson is with us. Carola, 3 minutes, 2 minutes for you? Mayor of Sala, please.
Thank you, Emilia, and thank you to all. It has been very interesting to listen to all of you, and I think that it has been made clear that it's so important to involve the local and regional governments in this work if we would like to find a solution for the future. I only would like to make one short remark, and it's about democracy, because I think that when talking about involving local and regional governments in the work, it's also a way of protecting democracy. Even during the pandemic, the political work must go on in our municipalities, cities and regions. And we need a stable democratic system that is well functioning. And I think that it's very important to not exclude the local level and the regional levels if we would like to take care of democracy for the future. So even if we're now talking about the health service system, and it's not prior to the local level, but it's very important for the local level. We must bear in mind that for the democracy for the future, we need an involvement of local and regional governments. Thank you very much for an interesting afternoon. Thank you.
Thank you so much. Let me just add that United Cities and local governments will be delighted to join this movement, and that we look forward to sharing many of the tools that are being developed by United Healthcare 2030. We look forward to continuing this discussion. Thank you very much, Co-Chair. Thank you very much, mayors from around the world. A happy high-level political forum further. Good luck to all of you. Please keep healthy, keep calm, and keep creative. Bye-bye. Thank you, Co-Chair.
Thank you. Thank you, everyone. Great
Bye.
session. Thank you.
It's just the start of a long conversation and a lot of action. Bye-bye.
Absolutely. Nice seeing you, Patricia Monte. Nice seeing you. Thank you. Bye-bye.
Bye.
Bye.